Hey guys, hope everybody's having a good day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to go over what to do for an abdominal strain. So for those of you who are unfamiliar, this is your abdominal region. So we're going to talk about basically anything in there that is strained. Now I'm not going to talk about a hernia. That's something completely different. So as always, with anything, you want to go and get it checked out with the doctor. If you're not sure, we offer free consultations. All you have to do is call our office at 215-997-9898. We'd be happy to get you in. But don't treat this as a hernia. This is just an abdominal strain. So what does an abdominal strain feel like? It feels almost sometimes like, your stomach is being ripped in half. It's very tough to sit up. Sometimes it can be painful standing. Sometimes it can even spasm. You can get shooting pain down your leg, into your butt, into the front of your leg. So it's something that can be extremely painful. And it is very important to fix it. And the only way to really fix it is to not do things. So you actually really have to limit this. And I'm always on the side of keep moving, keep moving, keep moving. With an abdominal strain, it's a little bit different because you really can actually wind up injuring yourself if you push through this. So it's not a matter of stretching. So please don't try and stretch an abdominal strain. It's not a matter of doing 100 more crunches and that's going to do the job. It's really actually what not to do and certain movements that are going to irritate it, limiting those movements. So let's talk about what those movements are. So if you have an abdominal strain, you're going to have pain somewhere in the front here, okay? Now, what you want to do is you really don't want to use your abdominals to sit up. So this is a big no-no. You might be able to do it. Now, sometimes people have to kind of do this, and they do it, and they get up. That's a big no-no. That puts direct pressure on the abdominals. That puts direct pressure on the strain. What you want to do instead is you want to bring your legs up, and then you're going to roll to your side, and then you're going to push yourself up. A lot more involved than just sitting straight up, I understand. However, if you sit straight up, you're just going to irritate that abdominal muscle. Now let's talk about bringing our legs up. So when you're dealing with an abdominal strain, what you want to do is you want to slide or lift your leg up. You don't want to just kind of bring it up because again, that's engaging your abdominal muscles. So you really want to avoid doing that at all costs. So you can start by just sliding your leg out to the side and kind of yanking up on your pants, bringing it up like this and then planting it down. Or you can just kind of slide it up the table like this and then grab on to your pants. You really want to avoid bringing them both up at once, okay? And you really want to avoid trying to bring one up without any sort of support. That's again going to put strain on that abdominal muscle and it's going to cause you more pain. You also want to avoid any sort of neck movement or any sort of movement that's going to put you in this sort of position. So anything where you're using that abdominal muscle to crunch, to sit up, to do anything like that, this again is going to put undue pressure on the abdominals. Also, the final thing that you want to avoid when you have any sort of abdominal strain is twisting. Either way, it doesn't matter. You want to avoid this twisting motion, okay? So you have to make more of a deliberate movement where you're turning your body, okay, to go one way or the other, but you cannot twist from one way or the other without using your abdominals. So really important that you limit that motion. It can be very difficult. Abdominal strains can last for a couple days. They can be very painful, so you really want to watch these movements. The less you do these movements, the quicker this is going to be able to heal. Now you can still work out. You can still do, I wouldn't recommend any abdominal exercises or any core work, but you can still do some exercises. But if you find that that's irritating, don't do them. This is something you really want to avoid irritating, and it will let you know right away if it's fired up. So it's more about what you shouldn't do than what you should do when you're dealing with an abdominal strain. You think you have an abdominal strain, or you know someone with abdominal strain and they want a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.